For almost the past year, we've been living in the COVID-19 pandemic. In the early 2000s, there was the SARS outbreak. In 2009, there was the swine flu. Most recently, however, there's a far deadlier one. I'm talking about the Ebola hemorrhagic fever. Ebola, also known as Ebola virus disease or Ebola hemorrhagic fever, ravaged through Western Africa throughout 2014 through 2016. Alongside the COVID-19 pandemic, Ebola might be one of the more notable epidemics and pandemics of the 21st century. In fact, at the time of recording this, Guinea just declared the first Ebola death since 2016. Ebola was discovered in 1976 near the Ebola River in the Democratic Republic of Congo. Since 1976, cases have popped up until the most recent outbreak in 2014. From early 2014 up until mid-2016, Ebola ravaged through Western Africa, mainly in Liberia, Sierra Leone, and Guinea. There were over 11,000 deaths. A factor in why Ebola was so devastating may be the lack of communication and the unstable government of these Western African countries. Sierra Leone and Guinea are two of the poorest countries in the world, both of which not even being in the top 150 countries based on GDP. This means that the virus would spread faster and more rampant without a stable government and plenty of medical professionals on scene to help. Let's talk about what the virus is, how it spreads, and the impact it has on your body. First, the symptoms. Symptoms include fever, sore throat, severe headache, muscle pain, intense weakness, vomiting, diarrhea, impaired liver and kidney function, internal and external bleeding. Ebola primarily targets the functional cells of the liver and the lining of the blood vessels in the body. According to the World Health Organization, fruit bats are the natural Ebola virus hosts. People can contract the virus through multiple ways, being contact with blood, organs, or bodily fluids of infected, or touching objects or something that has come in contact with the virus itself. There are many types of animals that can carry the virus, being chimpanzees, gorillas, fruit bats, monkeys, forest antelope, porcupines, all can transmit the virus. Ebola attacks the body by attacking the dendritic cells. These cells are the brains of the immune system, and without them working, the body will essentially turn on itself. Ebola is so deadly and dangerous because of its ability to get into the cells and then turn them against each other. This makes the body manufacture more Ebola cells as Ebola spreads throughout the body. The virus can easily enter the liver, and when it does, nothing good comes out of it. It will immediately start killing lots of cells and blood in the liver. This combined with all of the other things that Ebola does to the body, it's like, as stated by Kurzgesagt, many little nukes going off in the body causing eruptions at once.
Concentrate on the part that's critical to understanding Ebola and ignore the rest. So, usually, dendritic cells would activate an army of antivirus cells, support cells and antibody factories that would, together with the guard cells, wipe out the infection in a matter of days. But when Ebola strikes, it directly attacks the immune system. Some of the first cells it takes over are the dendritic cells, the brains of the immune system. The Ebola virus enters a dendritic cell by binding onto receptors for cell transport. Once it's inside, it dissolves its outer hull and releases its genetic material, nuclear proteins, and enzymes. In a nutshell, it takes over the cell, disables the cell's protective mechanisms, and reprograms it. The cell now becomes a virus production machine and uses its resources to build Ebola viruses.
Now that we know how Ebola works and how it spreads, let's talk about some of the numbers behind Ebola. The 2014 Ebola outbreak lasted from March 2014 to June 2016. The three countries most affected were Guinea, Sierra Leone, and Liberia. However, there were cases reported in Nigeria, Mali, Europe, and the United States. 28,616 people were suspected or confirmed to have the virus. Out of that, 11,310 people died to the virus. Now let's talk about the survival rate of Ebola. Half of all the Ebola deaths occurred within 8 days, and 90% of all deaths occurred within 13 days after symptoms onset. The chance of survival was 64.7% in 51 patients who had survived 8 days or greater after symptoms onset. It was 86.1% in 36 patients who had survived 12 days or greater after the symptoms had onset. This means that Ebola was killing rapidly. A specific strain of Ebola known as Ebola Zaire, which is the first discovered Ebola virus, at its worst had a 90% fatality rate. Now we can finally discuss the communication aspects of the Ebola virus outbreak of 2014. Western African countries are usually poor and have instability within. This made it very difficult for those affected countries to have an effective relief plan. This means that health experts from around the globe had to come in to help. Communicating with the sick and infected was very difficult because of the language barrier. This was stated by Rebecca Petrus in a TED Talk. Rebecca Petrus was the first director of Translators Without Borders, and they had a huge impact on spreading information during the Ebola outbreak. Another health expert responsible for communication throughout the Ebola outbreak was Paul Baltz of Nebraska Med Center. Paul Baltz stated he wanted to have a very open, honest, and transparent spread of information. He stated that the internal communications should run parallel to the external communications. He states it's important to have the public not think that there's something secretive or hidden going on behind the scenes. Let's talk about the Health Communication Capacity Collaborative, also known as the HC3 team. The HC3 team worked on the ground in Western Africa during the EVD outbreak. HC3's work includes developing messages and materials, coordinating the airing of messages on community radio stations, leading efforts to quickly develop and broadcast messages about prevention and vigilance during the multiple EVD flare-ups. Another one of HC3's impacts on the stop of Ebola virus was coordinating the message materials design group. This group ensured that all Ebola-related communication was correct, consistent, and harmonized. They also took a leadership role in the research and evaluation working group.
And I'm very interested to hear how much of a role did that communications and behavior change really play in kind of bringing hopefully the epidemic to its last end phase. I know I was reading a New York Times article where they're talking about the original IEC materials that went out, which was Ebola, it kills you, and that was pretty much it. And so, I mean, clearly the behavior change messaging has been developed since then. And I guess what would be the lessons learned from that, and how much did that play in terms of just bringing this to a halt?
Sam, would you like to answer?
Yeah, thank you. As you rightfully said, the initial messages were scary. I mean, they were scary. So what we did then was, number one, we tried to intervene by by having more survivors. And this was simple. I mean, any acute viral fever, we know it runs a course. So if you give supportive therapy, people can just survive. So what we did was give supportive therapy. And then when they were saying 80% mortality, we changed it to 80% survival now. And so in the initial reports that we were giving out that this is what disease or whatever, no, what we got was the survivors now were the ones who were telling the message. They were telling the message, that was one. Then the second thing, the reports that we gave out, the deaths and everything were what came last. There's the good news first. So first we speak about how many have survived today. So I still get daily reports. My daily report tells me how many survived to date. 8,000 have survived. How many have admitted this, have admitted, how many deaths comes last? And that's the last, it comes in very small letters. So it doesn't appear so scary because now we see a lot of people who have survived, and then we see a lot of hope in people because they know that they can come to the facilities and get well. And that is, in fact, what brought a lot of people who were out there in the communities just hiding the disease. That is what gave them confidence now to come to the health facilities for help.
Just a quick, thank you for raising that. I was sitting here thinking we hadn't talked about the community, and that's really the essence of Ebola control. And we know that from other countries that Uganda had a case last year, but they had one case. The community immediately recognized this is that disease. They instituted safe burial, washed their hands, et cetera, et cetera. The power for addressing Ebola really rests with the community.
Ebola was not just a crisis of health, it was also a crisis of communication. The communication, information, and relief efforts had to be spot on for the virus to be contained and under control. Lots of the lessons learned from the Ebola outbreak were used in the 2020 outbreak of coronavirus that we're living in as of now. This is Marcus Kane. Thank you for watching my documentary, Ebola, A Crisis of Communication.